Can you share a little bit about what ALS is? Some people might remember it from the Ice Bucket Challenge that, what year was that? That was probably 2015 or thereabouts. That took the world by storm and raised a lot of awareness, a lot of money for ALS. But for people who don't know, what is it exactly?
ALS, or amyotrophic lateral sclerosis, some people know it as Lou Gehrig's disease. It's a neurodegenerative disease. So essentially what they know, they don't know a lot about it, but the immune system is attacking the nervous system. And basically, as the muscles start to atrophy and die, someone slowly loses their ability to walk and then eat and then eventually breathe. It's been around, or they've known about it for about 150 years, and there still is no treatment or cure that is like actively shown to work. So it really is a death sentence. I mean, when people are given the diagnosis, they give you about 2 to 5 years to live.
And their brain is not affected. Is that right? So they can still communicate quite well if there is a means for them to be able to do that, which makes it, I guess, even more difficult. You have the person who's inside there.
Yes.
Except they have all of these physical limitations that come along with it.
Yeah, people really are like prisoners inside their own body where their brain is untapped. I mean, I do think there is a toll that is taken because people often will lose their ability to speak pretty fast because the tongue itself, is a muscle. And, it sounds a little maybe graphic, but like my dad's tongue started to shrivel. And so he lost the ability to speak pretty fast. So I think there's a toll on the mind in the sense that you're stuck in your own head, and that can drive a person a little crazy.
So what was an average day before the diagnosis, and what did one look like as things started to get pretty serious?
Before that, me and my sister were always athletes. My dad did work a lot. He was usually working 80, honestly, sometimes like 100 hours a week. Like he would just come home to sleep. And I do think that contributed to him getting sick. He was also a football player, so took a lot of like body trauma. He was a 250-pound, 6'5" guy, like a big guy. But yeah, as like far as our household, he was often working. And my mom was a stay-at-home mom. And then after that, my mom became my dad's 24-hour caregiver. And it was very taxing on her. She couldn't really leave the house almost ever. Like I was doing most of our grocery shopping, like me and my sister, once we could drive. I was usually cooking for our family starting at like 8 or 9. Once he started showing signs, my mom was often having could only do so much, was like supporting my dad trying to figure out what was happening. So I sort of took on the fatherly role in my house, honestly. Once he had a trach, had to suction his trach, had to feed him through the feeding tube. If she needed to sleep or needed to go to a doctor or something, we had to kind of schedule out who was going to watch my dad. Because, if a battery dies, something get logged in his throat, he's gone. So there was a big level of responsibility.